Hi everyone, I'm Brooke Swanson.
And I'm McCall Fleming.
And we're here to get down to the basics of pharmacology.
This is Pharm 101 for beginners.
101. So, in order for us to do that, we're going to go over one of the basic principles that we learned our first semester of pharmacology. It's an acronym called
A.D.M.E.
So, we're going to begin with A, which stands for absorption. So, absorption is the process of moving a drug from the site of administration to the bloodstream. For any given drug, a specific percentage of the drug is absorbed, ranging from 0 to 100%. Pretty obvious, right? So there's several factors that will influence the absorption of a drug. The route of administration. Are we doing IV? Are we doing PO? Are we giving it anally? I don't know. There's drug concentration and dose, GI tract environment, blood flow to the absorption site, drug ionization, so is it a positive or a negative charge, drug interaction and drug-food interaction, what's going to keep this from getting absorbed properly, and surface area, so the small intestine, so a lot of drugs, are they absorbed in the intestines? Where are they being absorbed at? So that is A, absorption.
All right, and the second is distribution. So D is for distribution. Distribution describes how drugs are transported throughout the body. The simplest factor determining drug distribution is blood flow. The physical properties of a drug influence how it moves. Some tissues will accumulate and store drugs in high concentrations, such as the teeth, bones, eyes, and adipose tissue. Many drugs bind to plasma proteins, particularly albumin, to form drug-protein complexes. The number of binding sites on protein is limited. The drugs with the greatest affinity will win, so it can displace another drug. There are other barriers such as the blood-brain barrier and the fetal-placental barrier. And then another part that we want to go over is metabolism.
That stands for metabolism, M. So metabolism is a process that changes the activity of a drug and makes it more likely to be excreted. So some drugs require metabolism to produce their therapeutic action. We call these prodrugs. Most metabolism is in the liver and is accomplished by an enzyme system. So if somebody is having liver failure or other things, it's good to know where this is being metabolized. If it's being metabolized in the liver, it might affect the way the medication presents itself. So we'll talk about the first pass effect. So the first pass effect renders a large number of oral drugs inactive by hepatic reactions because drugs do pass through the portal system before entering the systemic circulation. Because this route of delivery are considered. Some patients may have diminished hepatic metabolic activity, like we were talking about. Some of the people that are most common to have this decreased hepatic activity is people that have liver failure or cirrhosis of the liver. We have our elderly, the newborns, their livers aren't fully matured yet, alcoholics, and then genetically some of us just have lower hepatic activity. So that is metabolism, very important to understand.
All right, and the last part of A.D.M.E is E, which stands for excretion.
That's an E.
Excretion processes eliminate drugs from the body. So this is taking the drug that was in our body and taking it out. So we do this through a couple of different ways. The first one is renal excretion, so through the urine, but 80% of drugs go through the urine. Then we got the pulmonary excretion, which is when we breathe out the drug. We got the glandular secretion, which is us sweating out the drug. And then also the fecal and biliary excretion. The biliary excretion may be reabsorbed and circulated back. Drugs use diffusion, which is from high to low, and active transport, which is requiring energy to cross the plasma membranes to reach the target cells.
So That is A.D.M.E. And in order for us as nurses to understand how our drugs are going to affect our patients more, we need to make sure that we understand the A.D.M.E of the drug. Where is it? How is it being absorbed? Where is it being delivered? Where is it being metabolized? And how is it being excreted? This way we can provide the greatest quality of care for our patients.
It's also important to know A.D.M.E so that we can make sure that our patients don't get too toxic doses. We don't want too much drug in their system. We want to make sure that it's out before we give them another dose of the medication.
Anyways, thanks for joining us for our Pharmacology 101 A.D.M.E review.
Hope to see you back.